how do you evaluate AI's impact on patient care specifically? Because at the end of the day, if we're involved in healthcare, it should be, health care, like the care of the patient, and the utility, right, should be in the impact of these models. So how should we be thinking about that impact measurement? What is the sensitivity there?
So, I mean, again, we don't have as a community, not fully sorted this one out yet, but on our campus, we employ a procedure we call a firm assessment for fair, useful, reliable models. And what it is essentially, you could think of it as a game of 20 questions. As you ask up front, like, what do you expect or hope to achieve by using this model? Who's going to act based on the model output? Do they have an incentive to act? Do they have the time to act? Assume they followed and on the model's recommendation, like, what effect do we hope to achieve? How often is it the case in the past? What assumptions are we making about the successful completion of whatever intervention that we're going to make? So we ask a whole bunch of questions. We can run a little simulation and then get an estimate that, look, based on all of these things, the expected benefit is in this range. And we write it down. And then when you deploy that thing, you can then monitor, like, are we within range? Are we completely outside of range? Are we not getting anything? And so we use this firm assessment, which is itself embedded in a larger rhythm of life, which we call a responsible AI life cycle. And the gist there is, you don't want this kind of an assessment thing to be its like own little ivory tower where you go and pay your $5 and move on. It has to be in your organizational rhythm. And so most places have sort of standard processes by which how you will get permission, how you deploy something, and so on. So we inject it into that. And at the same time, we don't want to do this for everything. Like, if the model is about improving the spell checker in my word processor, like, do I really need to spend so much time on it? Like, just try it. If you don't like it, turn it off, right? And so there's that judgment involved in what is it that would need this level of rigorous assessment as well.
It leads me to a question that I've been thinking a lot about, because I don't think that there's an answer, which, what are the benchmark standards, right? So
we don't have any. We don't have any. So let's build on that a little bit. So right now, everybody's talking about large language models and how they're going to change everything. Fine. We did a little survey where we looked at about 520 papers, 519 to be exact, of studies people had done using a language model to do a medical task. And we asked 5 questions of every paper. What is the data that you're using? What is the medical task or healthcare task you're doing? What is the language task that you're doing? What's your metric of evaluation? And who did the study? Which discipline? 5 things. 95% of those published papers were not even using real EHR data for their evaluation. I was like, okay, do I trust anything? The majority healthcare task was something we euphemistically called enhancing medical knowledge, aka answering USMLE questions. Language task, no surprise, question answering. And the majority of the work done by internal medicine and those disciplines. Now, if you really want to examine the role of language models in healthcare, we first have to define the task we want these things to do. If it's diagnosis, if it's care coordination, if it's differential diagnosis, recommending care, translating patient reports, responding to messages, whatever, make a list of the 20 things you want done, and then test the model for that use case. Mm-hmm. And the metric, again, all of those studies were enamored with accuracy. Almost no attention on what's the uncertainty in the model output. If you're doing diagnosis, like, what I really care about is how certain are you?
Right. Yeah.
And so I think we really need to, as a community, sort of up our game in terms of what is it that we hope to achieve, define that benefit, and then verify it.
It's interesting. The question that I hear asked over and over again, I'm just going to paraphrase it in the way that I hear it. And I hear this from patients, right? And I think I hear the corollary of it from physicians when I talk to them is, what did someone like me do in this situation? And did it work? It's
exactly
very basic. It's like a review. Like, I wouldn't go to a restaurant without reading the reviews these days. But when I say, like, should I choose medication A or medication B or surgical procedure A or some combination, what I'm really asking is, what's is that going to give me some result that I'm going to do? And it leads to this idea of what is working, right? And this is kind of like where I get to the benchmark. Well, maybe I think it works, but it's a poorer result than anybody else got. Like that's not part. So how do we start thinking about comparison? If all these models were poor, like how would you even start to compare one against the other, right? And start to actually move the field forward in that.
Yep. So a couple of ideas there. Particularly as relates to language models, they only answer based on what they have seen. They have not seen your and my medical record. And so if I ask what happened to patients like me, it's going to answer based on Reddit, New York Times, PubMed, whatever, right? Oh. And so first we have to see, is the task even sensible to propose to a language model? So again, you had mentioned Atropos in the beginning. One of the things that the Atropos is doing really well is that we're not going to ask the language model to answer what happened, but we will use the language model to figure out what your real question is and say, did you mean pneumonia? Did you mean this ICD code? Did you mean this CPT code? Did you mean that? Once you have a well-formed question, you can then answer it from real EHR data. And then once that math is done using standard methods, you can have the language model summarize the output in a paragraph for you. And so answering this exact same thing, what happened to people like me in a similar situation? But it's not the language model answering from its own memory or its own weights. The language model is just an agent. It's listening to your question, going to a database, running some established epidemiological analyses, coming back and summarizing an answer. They call this thing chat RWD, chat with real world data.
Yeah, I think this is, and I've been fascinated with what you guys are doing there. And it brings me back to something that kind of I've always thought about, which is it's very hard to know what data you need or even want to use until you understand your question. So over many years of working in real world data and just different parts of the business, right, or the research community around that, I have seen many times the idea of the perfect database floated. We're just going to go and make data. And we live in a time with AI and with all the hype around LLMs where everyone's like, data is the new gold. It's the new whatever it is. And I keep scratching my head and trying to say, like, what data are you talking about, right? And what form does it want? I understand trying to accumulate as much data because data access is an issue. So I want to have access to as much as possible. But actually trying to organize it in any way or put it in any form without what you talked about, which is clearly defining what the research question is and the specific parameters, to me seems like an exercise of futility, like potentially a massive sink of resources. Right.
100%. I mean, there were days when, and there are probably still entities that spend, $50 million a year just buying data. And then you almost never touch 90% or more of those records because you never ask a question that invokes the need for those records. A sort of cartoonish example is that, if you have data on 1 million biologically defined women and you ask questions about prostate cancer, that's completely off topic. It's not going to work. That's a cartoon example, but you get the point. So you're absolutely right that you have to score the value of a data set in light of the question you have. And I think if we are to move to a stage where we are answering questions about what happened to similar patients or what happened to others in a similar situation, step one, well, figure out the question, obviously, but step two after that is which data set should I ask the question on? And again, this fun company we keep talking about, Atropos, actually does a data fitness scoring. And it is not an absolute score. It's not that this data set always wins. For your question, this data set is good.